Working together for your health, a strategy for success. Before watching the video, please note the following. The term health and care professional is used in this video to describe those who may be involved in treating you and developing your care plan with you. For example, doctors, nurses, physiotherapists. You will also hear the term care plan. This is an agreement between you, the patient, and your health and care professionals, which is created to help manage your health concerns, to plan your treatment, to detail your goals, and to monitor your progress. Long-term illness and multi-morbidity. An increasing number of people find themselves managing more than one long-term health problem or disease at the same time. Patients who have 2 or more long-term health problems are referred to by health and care professionals as patients with multi-morbidity. Living with a long-term condition can not only make you feel unwell, but can also create feelings of inability to cope, loss of control, or low mood. It can be more complex for you and your health and care professionals to manage and treat multiple conditions than it is to deal with a single condition. Different treatments have to be coordinated. This is particularly true when managing medications, where a medication may be beneficial to one of your conditions, but not to your other condition. The professionals taking care of you need to balance a number of things to find the best treatment and drug combination for you. Purpose of this video. We have made this video to help you to better understand the challenges of dealing with more than one long-term health problem. It will also explain how the C3-Cloud project can assist you and your health professionals in managing your care more effectively and proactively. It will also explain the principles of self-management by explaining how you and your loved ones or carers can be more actively involved in making treatment and follow-up decisions jointly with your health and care professionals, and some things that you can do to help yourself. We invite you to watch this video as part of your care plan. The C3-Cloud project and you. As you know, you have been invited to take part in the C3-Cloud project because you have 2 or more of the following long-term health problems: diabetes, heart failure, kidney failure, and depression. The C3-Cloud project uses computer technology to help you, your healthcare professionals, and those who are involved in your care at home to better manage your conditions through partnership, shared care plans, and training. The C3-Cloud system, which has been developed with your health and care professionals, is designed so that your conditions can be viewed and treated together and not separately. It is important that you work in partnership with your health and care professionals by asking questions, telling them how you are really feeling, how well your treatment is working, any problems that you are experiencing, and what goals are important to you. You might want to take a list of questions with you to your appointments. Through your input, we can make sure that your health professionals and carers are best placed to help you to understand your conditions and to guide you with managing them. The C3-Cloud technology will help you and help them with this. How will my care be managed during the trial? Using the C3-Cloud system, a care plan will be created jointly by you and your health and care professionals. Your care plan will list all of your medical treatment and will guide you with setting realistic goals for you to achieve and activities for you to do, including health education material. The care plan will be accessible by yourself, your health and care professionals, and if you wish, those friends and relatives supporting you. You will be able to report feedback on your goals and activities, and make notes about how you are feeling and the progress you are making. This can then be reviewed at your next visit to your doctor or health and care professional. As part of your health education journey, C3-Cloud will make some other resources available to you at the relevant time. For example, questionnaires and charts to monitor how you are feeling and how you are progressing. This information can be shared with your health and care professionals through C3-Cloud, for example, your blood pressure readings. You will also have access to information and advice leaflets covering a range of topics, for example, diet and medication. Your healthcare professional may suggest attending support groups or direct you to where you can find relevant information. These will all be tailored to your condition, your goals, and how you are feeling. What can I do to take care of myself? There are a number of things that you can do to help yourself, some of which you may already do. It is very important to follow the recommendations discussed with your healthcare professionals. For example, taking your medication correctly and following specific diet or lifestyle advice. C3-Cloud will encourage and help you to do these things by providing you with some tools and teaching you some techniques. Medication. Make sure that you take your medication correctly, as discussed with your healthcare professional. Tell them if you are worried about taking your medications or any side effects. To make sure you are only taking the relevant medications, you or your health professionals should propose that you jointly review the complete set of medications you are taking on a regular basis, especially after hospitalization or a specialist appointment. Weight, diet. To achieve or maintain a healthy weight, you should follow the diet and physical activity agreed with your health and care professional. It is important to moderate your consumption of fat and sugar. Where possible, limit your intake of salt and foods that are rich in salt, like canned food and processed meats. Remember to drink the right quantity of fluids. Physical activity. You should carry out physical activity which is agreed as being suitable and safe for your conditions, such as walking or swimming. You may also need to change the way you do things, ensuring that any tasks or activities that you undertake are safe and beneficial, and don't put unnecessary strain on you. Smoking and alcohol. Do not smoke, or if you do smoke, discuss with your doctor how to quit. Do not break the habit of your personal hygiene. Keep looking after yourself. Proper rest and sleep are vital for your health. We recommend you try to keep a regular, organised lifestyle by going to bed and getting up at the same time every day. Emotional well-being. It is equally important to take care of your emotions. Tell your health and care professionals if you are feeling down, frustrated, or not coping. How to recognise when you need urgent help or attention. It is important that you recognise warning signs and major health concerns and act appropriately. You should call your healthcare professional or out-of-hours service if any of the following happens. If you have an intense and new onset of pain, especially in the chest or abdominal area. If you feel fatigued, breathless, or shortness of breath when idle. If you have a fever of over 38 degrees Celsius, 100.4 Fahrenheit, with chills. If you have blood in your stools, vomit, or urine. If you have problems which prevent you from drinking liquids. If you have reduced urine production. If you cannot sleep properly and constantly feel tired and sleepy for over a week, you should check with your doctor. If you have symptoms such as a loss of strength in an extremity that impedes you from standing upright, or a droopy mouth, and/or you have difficulty speaking, you should call the emergency service. If you are seriously concerned, call the emergency service.